Our hips are remarkable joints, built for both strength and flexibility. They are designed to support the weight of our bodies while allowing a wide range of motion. This unique combination of stability and mobility is what makes the hip joint so special. They bear our weight, allowing us to walk, run, and move with ease. Whether we're taking a leisurely stroll in the park, running on a track, or hiking up a challenging trail, our hips are constantly at work, enabling us to enjoy these activities. But like any well-used welcome mat, the cartilage in our hips can wear down over time. This wear and tear is a natural part of aging, but it can be accelerated by factors such as overuse, injury, or certain medical conditions. This can lead to pain, stiffness, and difficulty performing everyday activities. Simple tasks like standing up from a chair, climbing stairs, or even walking can become challenging and painful. Osteoarthritis, also known as wear and tear arthritis, is the most common culprit behind hip pain. It is a degenerative joint disease that affects millions of people worldwide, particularly those over the age of 50. It occurs when the protective cartilage that cushions our joints gradually deteriorates. This cartilage acts as a shock absorber, allowing the bones to glide smoothly over each other during movement. This deterioration causes bones to rub against each other, leading to pain, inflammation, and limited mobility. The friction between the bones can cause significant discomfort and can severely restrict our range of motion. Imagine the smooth surface of ice turning rough and cracked. Just as it becomes difficult to skate on rough ice, it becomes painful and challenging to move when our cartilage is damaged. This is similar to what happens to the cartilage in our joints with osteoarthritis. The once smooth and resilient cartilage becomes brittle and worn, leading to increased friction and pain. As the smooth surface breaks down, movement becomes increasingly difficult and painful, hindering our ability to enjoy life to the fullest. Activities that were once second nature, like walking or bending, become arduous tasks. Just like a worn-down welcome mat can make a home feel less inviting, a damaged hip joint can significantly impact our quality of life. The constant pain and discomfort can make us feel less inclined to engage in social activities or pursue our hobbies. It can limit our ability to engage in activities we love, affect our sleep, and even lead to feelings of isolation and frustration. The impact of hip pain extends beyond the physical, affecting our mental and emotional well-being as well. It's important to seek medical advice and explore treatment options to manage the pain and improve our quality of life. When hip pain becomes unbearable and conservative treatments fail to provide relief, hip replacement surgery can be a life-changing solution. This procedure involves removing the damaged bone and cartilage from the hip joint and replacing them with artificial components, known as prostheses. Think of it like replacing a rusty hinge on a door. The new hinge allows the door to open and close smoothly, restoring its function. Similarly, hip replacement surgery aims to alleviate pain, improve mobility, and help individuals regain their independence. The artificial hip joint, typically made of metal, ceramic, or plastic, is designed to mimic the natural movement of a healthy hip. This allows patients to resume most activities they enjoyed before the onset of severe hip pain. Hip replacement surgery is a significant procedure, but it has a high success rate in relieving pain and improving quality of life for millions of people worldwide. While age is a factor, it is not the only determinant when it comes to hip replacement surgery. Many people assume that hip problems are exclusive to the elderly, but this is a misconception. Hip replacement surgery is not exclusively for the elderly. In fact, individuals of all ages can experience hip issues that may necessitate surgical intervention. From young athletes to middle-aged adults, hip problems can affect anyone. People of all ages can experience hip problems that may require surgical intervention. For instance, young athletes might suffer from hip injuries due to high-impact sports, while middle-aged individuals might face hip pain from overuse or genetic predispositions. However, osteoarthritis, the leading cause for hip replacement, is more common in older adults. This degenerative joint disease wears down the cartilage, causing pain and stiffness. As the condition progresses, it can severely limit mobility and quality of life. So how do you know if you might need a hip replacement? Recognizing the signs early can make a significant difference in managing the condition effectively. Persistent hip pain that limits your daily activities is a key indicator. This pain can be constant or intermittent, but if it affects your ability to perform routine tasks, it should not be ignored. This pain may worsen with activity, making it difficult to engage in physical exercises or even simple movements. Activities that once seemed effortless, like running or walking, can become excruciating. It can make it difficult to walk or climb stairs, forcing you to rely on handrails or other supports. This limitation can significantly impact your independence and overall quality of life. The pain can even disrupt your sleep, causing you to toss and turn at night. Waking up in pain or being unable to find a comfortable sleeping position are common complaints among those with severe hip issues. Other signs include stiffness in the hip joint, which can make bending over to tie your shoes or stretching your hip a challenging task. This stiffness often worsens after periods of inactivity, such as sitting for long durations. A grinding sensation during movement is another red flag. This sensation, often described as a bone-on-bone feeling, occurs when the cartilage has worn away and the bones are rubbing against each other. Swelling in the hip area can also indicate a problem. This swelling is usually a sign of inflammation, which can be caused by various underlying conditions, including arthritis or injury. If you experience any of these symptoms, it is crucial to consult with a healthcare professional for proper diagnosis and treatment. Early consultation can help identify the root cause of your hip pain and determine the best course of action. Remember, early detection and treatment can significantly improve outcomes and potentially delay the need for surgery. By addressing the issue promptly, you can explore various treatment options, including physical therapy, medications, and lifestyle changes. So don't ignore persistent hip pain. Address it promptly to ensure the best possible outcome for your joint health. Taking action early can help you maintain your mobility and improve your quality of life. Section 4. Inside the operating room. The hip replacement procedure. Hip replacement surgery is a highly sophisticated procedure performed under general anesthesia, meaning you'll be asleep throughout the operation. This ensures that you won't feel any pain during the surgery. The anesthesiologist will carefully monitor your vital signs such as heart rate, blood pressure, and oxygen levels throughout the procedure to ensure your safety. The surgeon makes an incision in the hip area to access the hip joint. The size and location of the incision can vary depending on the surgical technique used and the patient's anatomy. Some surgeons use a minimally invasive approach, which involves smaller incisions and may result in a quicker recovery. The damaged ball at the top of the femur or thigh bone is then removed and replaced with a metal stem that's inserted into the hollow center of the femur. This metal stem is designed to provide stability and support for the new hip joint. The surgeon may use bone cement to secure the stem in place, or they may use a cementless technique that allows the bone to grow into the stem over time. A ceramic or metal ball is then placed on the upper part of the stem, replicating the original ball and socket structure of the hip joint. The choice of material for the ball can depend on various factors, including the patient's age, activity level, and any allergies to certain materials. The goal is to create a smooth, durable surface that allows for natural movement of the hip. Next, the damaged socket in the pelvis is prepared. The surgeon uses specialized tools to remove any damaged cartilage and bone, creating a clean, smooth surface for the new socket. This step is crucial for ensuring that the new hip joint functions properly and reduces the risk of complications. The surgeon removes any remaining cartilage and bone, then attaches a new artificial socket liner made of plastic, ceramic, or metal. This liner is designed to fit snugly into the prepared socket and provide a smooth, low-friction surface for the new ball to move against. The choice of material for the liner can affect the longevity and performance of the hip replacement. This liner provides a smooth surface for the new ball to move against. The goal is to mimic the natural movement of the hip joint as closely as possible, allowing for a full range of motion and reducing the risk of wear and tear on the new joint. The surgeon will carefully check the fit and alignment of the new components to ensure optimal function. Once the new components are in place, the incision is closed and you are taken to a recovery area. The surgical team will use sutures or staples to close the incision, and a sterile dressing will be applied to protect the wound. In the recovery area, your vital signs will be closely monitored as you wake up from anesthesia. Pain management is an important part of the recovery process, and you may be given medication to help manage any discomfort. The entire procedure typically takes 1 to 2 hours. However, the total time you spend in the operating room may be longer, as it includes time for anesthesia, preparation, and post-operative care. The length of the surgery can vary depending on the complexity of the case and the specific techniques used by the surgeon. Thanks to advancements in surgical techniques and anesthesia, hip replacement surgery is generally safe and effective. Most patients experience significant pain relief and improved mobility after the surgery. The success of the procedure depends on various factors, including the patient's overall health, the skill of the surgical team, and adherence to post-operative care instructions. With proper rehabilitation and follow-up care, many patients are able to return to their normal activities and enjoy a better quality of life. Section 5. Life after hip replacement. The road to recovery. After surgery, you'll wake up in a recovery room where medical staff will monitor your vital signs and manage any pain. You'll likely stay in the hospital for a few days as you begin your recovery journey. During this time, you'll receive pain medication, start physical therapy to regain strength and mobility in your hip, and learn how to care for your incision site. Physical therapy is a crucial part of the recovery process. You'll gradually progress from walking with an assistive device, like a walker, to walking independently. The goal is to restore your range of motion, build muscle strength, and help you return to your normal activities as soon as possible. Most people notice significant pain relief and improved mobility within a few weeks after surgery. However, full recovery can take several months, and it's essential to follow your doctor's instructions and attend all physical therapy sessions.